So the whole idea after a surgery, especially in the abdomen, and specifically mine was taking my gallbladder out, is you want to move as much as possible within pain tolerance. So while I was recovering in the hospital, they were giving me pain medication and trying to have me walk the hallways to and from the bathroom. But I needed assistance, so I didn't fall or anything like that. I had to always call on the nurse to have me do that. And the more I did them, the more it became easier and easier. When I got home, I was also using up a lot of my upper body strength just to get on and off the bed, since the beds here at home does not lift, because the bed at the hospital does this kind of thing and then also ups on the legs area, and beds here at home are just flat. As a massage therapist trying to heal other people, you also have to know how to heal yourself. And unfortunately, there are times in which we are so focused on the pain that we forgot that we are healers and we can actually heal ourselves. Marianne has been working tirelessly at Century Massage because at the office, because of the fact that she has taken on most of my clients, and others have opened up their schedule so they can take on more of my clients. I am now breathing a little easier. I am moving a little easier, and I've found a few things that I thought is important enough to create a video to assist anyone who has gotten their gallbladders out or going to, how to be as comfortable as possible. So again, number one, move. Move it or lose it. Okay, just do the minimum. Walking, sitting, standing, and then what, as a massage therapist, you also do tummy massages, and that's what I've been doing. So with flat hands, you can go hand over hand or just one hand. I prefer hand over hand, and it can be over your t-shirt. I'm not going to show you my belly. I have gauzes and bandages on there with holes in different areas, but I do hand over hand. Right now I'm sitting down. You can be sitting if that is comfortable. You can be reclined if that's comfortable, or you can be flat out on your back. Okay, right now I'm moving enough that certain positions don't hurt anymore. But in any position that you feel comfortable, hand over hand is very lightly. If you're looking at your tummy, you're doing clockwise. So here's my yoga wheel that I'll be using to assist me in doing the self-massage. Here I am positioning myself, sitting cross-legged, putting my low back to the wheel, and slightly extending my back so that I can have more access to my stomach. With hand over hand, I'm slowly gliding clockwise all around my abdominal area. Now I'm going to be pushing fluid medially and also inferiorly towards my hip area where we have lymph nodes in the inguinal area. Of course, even though my gallbladder was on my upper right quadrant, I still would like to do the same thing to the other side to make it feel balanced. This technique is actually a manual lymphatic drainage technique. Now I'll be both using my hands on either side, pushing towards the midsection, and again, pushing fluid medially and inferiorly down towards the lymph nodes of the hip. And now a little bit of trigger point therapy. So here I'm putting pressure on the area where my gallbladder used to be, and just enough pressure to give it a little bit of pain, and then holding it for a few seconds until the pain subsides. If there's too much pain, you might want to back off on the pressure. You'll be doing this trigger point therapy for as long as you need to. Also, don't forget the other side as well. Areas that you find that are more tender, you might want to give special attention by staying on and giving pressure a little longer. Make sure that you are breathing nice, easy, slow breaths when you're working on very tender areas. And now to close, we return to the hand over hand, clockwise motion on the belly. If you'd like to see more videos like this, please make sure you subscribe to our channel. Thank you.